They always come in large numbers, young and old, male and females. But one thing that sees the difference is that they come from extremely poor backgrounds and cannot afford to miss on this one chance of being operated on free of charge thanks to the initiative. This initiative is headed by Dr. Mishak Onguti, who together with the help of surgeons, nurses, doctors and other supportive staff from different hospitals in Kenya have volunteered to carry operations on children and old people who have lip deformations, tumors and growths on their bodies. This initiative has helped put back a smile on the lives of the beautiful children of Kenya.
When you use with halogen, heterogeneity,
This team, which engages in highly specialized and costly work, have already visited different districts in Kenya where they have successfully carried the operations. They were in Bungoma County at the Webuye District Hospital where they surpassed their targeted number by doing over 70 operations. Here we meet with Enoch Shatuma. He hails from Fubuye village in Webuye District. He had brought his son Alex Shatuma, 11 years old, to be operated on. He tells us that his son was born with the condition in 1999.
I've brought my son here for the operation so that he can go back to normalcy and be able to play with other children.
We also meet Pamela Nanjala, who is 25 years old, as she holds baby Faris Wanyonyi, who is 4.5 months in her hands. She can't help but show gratitude to the Help a Child Face Tomorrow initiative for operating on her daughter free of charge. She tells us that she has visited different hospitals, but they have turned her down since she has no money to cater for the operation. She also reveals to us the belief that people from her community have about children born with this condition. People in my community were skeptical when I gave birth. They saw it as an abnormal condition. I visited different hospitals up to no avail, but I thank the initiative who have operated on my child. May God bless them. Paul Tanui is 60 years old and the oldest beneficiary of this operation. Born with a condition which impaired his speech, through his son, he shows how belated he is for being operated on despite his age. His family is also upbeat about his new look.
We heard it over the radio and decided to try it, though we had doubts that they would operate on him. But we are so glad. Thank you.
These are just some of those who were operated on, and here is a brief preview of their condition before and after operation. Mr. Anguti notes that myths and superstitions about the condition are one of the major challenges facing them, since some communities perceive it as an abomination.
These myths, when the science has come in, and it doesn't hurt for you. I think yes, the government has a big role to play on this particular aspect, because you see, one of the conditions and the constitutional right is that we must be able to provide good health to people. And I have a feeling that through the administration, through the chiefs, through the network that is there, they could be able to identify these people and actually let them be registered, and you can be able to treat them out. I mean, that is where the thing is. And I would also request, in fact, the media, see, join us, be part of the group so that you can be able to source for these people to come forward. Because you have looked at all these people and you can see that these people cannot even pay you a single cent, because if they had, they would have had this treatment done long before.
When there is a radio show presentation, they explain to the patients what it's all about, their relatives to understand. But many a times we find hindrances at the families and their cultures. Yeah, they hinder them from coming out because these are people who are closeted inside the house. You never see them.
He requests for support from all stakeholders in the health sector to step up sensitization campaigns to curb the problem of stigmatization. Since these operations are done to people who come from extremely poor backgrounds at no charge, the challenge of finances is one of the major headaches for the team, which pays for its own transport, food and accommodation during its missions worldwide.
To hold a camp, this type of camps, question of millions of shillings because of supplies, volunteers accommodation, transport, food and other things. I will suggest any national, international NGOs, any national, international big organization who earns billions of shillings, they can spend little money for the poor and needy people. It can help a lot. We can change a lot of lives.
They are therefore requesting for support from interested donors and organizations to help them go on with their missions worldwide and bring back that beautiful smile on the faces of children.